Please take your seats. So the last portion of our program, as I said, will be dedicated to three really key areas for those who sponsor worksite centers, and that's in virtual services, measurement, and utilization. So we're going to start this off with the really key thing that has developed since COVID, and that is virtual services. We had less than 18 to 20% of people used to take advantage of an employer's nurse call line or telehealth participant. And as our centers transition most of their services, 85% of our member services transitioned into virtual care. And so it has become really a fundamental part and a key element of a worksite center. So with us today, we've got John Howard, Chief Growth Officer for Evernorth, and Shannon Custer, Vice President and Head of Center Operations and Client Services for Evernorth. We'll be talking about how to integrate virtual services and the value of that. So please welcome Shannon and John.
Terrific. Well, thank you so much, Larry. Really appreciate it. Feel like giving you a big rah-rah like the folks next door with everything that you've done to put this on and everything that you do certainly for our industry. So again, my name is John Howard. I'm the Chief Growth Officer for Evernorth Direct Health. This is Shannon Custer, our Director of Operations, and we are delighted to share three client stories with you all today that is really focused on virtual care. And what's cool is they're all different. It's not a certain way of doing it. They all are individual with how they are going about deploying virtual care. So first, we're going to touch on Mohawk Industries. And so we're fortunate enough to have Pauline in the house back there. And Pauline is letting us tell their story today. We have 21 on-site wellness centers with Mohawk. And we're going to really focus on their explosive growth from virtual. And so Shannon will touch on that. Then we'll transition into the city of Miami, Florida. We have a health and wellness suite with them. It's a very interesting model where it's really led by a registered nurse leveraging Tyto devices, which Peter will pass out here in just a moment. So a little show and tell so you can see what the provider uses. And they deploy and they connect to a virtual provider. So again, a little bit of a different, when you think of on-site wellness centers, this is a little bit of a different model. And then we're going to close with Cigna and Palm Beach Sheriff's Office. And they take the Tyto devices at home that Peter, you can go ahead and hand those out now. And then they connect into the care team at the wellness center. So these are the three different stories that we're going to share. So feel free to check out the Tyto devices as well. So let's go ahead and get started. So Larry, again, great job with this particular study that you all did. And this is such a powerful statistic. So the folks in the back who maybe can't read the fine print, in 2018, only 21% of on-site wellness center partners or clinic vendors, however you want to say, deployed some sort of telehealth or virtual care. 4 times the amount now. We're at 78% utilization with some sort of telehealth. So again, to Larry's point, COVID forced us to think differently, right? To be more nimble and flexible. And so folks, when I see this number, and I appreciate, back to your point, Larry, with the nomenclature of using the word clinic, right? Clinic feels very reactive. I think our days might be numbered when we call ourselves on-site or work site, because when you look at this intersection, 78% of us are doing virtual. So it kind of feels like we're more of a hybrid wellness center. And so that may, the age-old debate of on-site hyphen or on-site, we can maybe drop that altogether, right? If we can move to hybrid. Now, I know that some wise guy's going to probably put a hyphen between, hybrid care, but, that might be where we certainly are going. So you can also see that the disease management, behavioral health, physical therapy, all these other specialties has also increased over time. So before we get into the 3 client stories we wanted to share with you, just wanted to give you quickly a little bit of background on Evernorth. So when you think of Evernorth, we are essentially the healthcare services arm of Cigna. We are owned by Cigna, and we were formerly Cigna On-Site. So we have been providing primary care, urgent care for over 40 years. So just quickly walking you through the scopes of services that we offer. Today, we operate right at about 60 health and wellness centers throughout the United States. Custom coaching, we have 170 custom coaches throughout the United States. What's really big right now, as you can imagine, is behavioral health and placing behavioral health coaches. Certainly wellness prevention, so think on-site labs, biometrics, flu shots, those types of screenings as well, and then COVID testing solutions. So again, just wanted to give you a real quick flyover on who we are at Evernorth. So with that, we're going to now jump into our client stories, and I will introduce Shannon to go over Mohawk.
Yeah, thank you, John. So Cigna's been lucky enough to work with Mohawk over the last 10 years, bringing forth a health plan for their 27,000 members. For those of you that don't know, Mohawk's the largest, I'll give them their quick commercial, the largest flooring manufacturer in the world. So they have a global footprint, and they also have members in almost every single state in the United States. They're concentrated mainly in the Northwest Georgia area where their home base is in Calhoun, Georgia. And then they have a large concentration in Texas as well. So like John mentioned, we have 21 different centers with them in 8 different states. 6 of those are total virtual wellness centers, and 2 of them have the capability they have a virtual wellness room. So if our provider at the on-site bricks and mortar center is full that day, they can actually move into a virtual room and connect with a virtual provider. So just so you know a little bit about our team there, Mohawk's really invested in just an overall clinical model, and they push us constantly to be innovative and agile, as you'll see here. We have 84 dedicated team members to Mohawk, and when I say dedicated, it includes our on-site clinicians, our coaches, our registered dietitians, and our care navigators. So they make a large investment with us, and because of that, they just make us better as an organization and some of the care delivery methods that we have. So we also, in 2021, just so that you understand how busy they are, they had almost 80,000 appointments that came through these centers, and so we're highly utilized. And a big part of just how Mohawk really seeks care delivery. So our providers are really, they really help our, oh, good. I'm getting the claps now too. So they really help the Mohawk members on their healthcare journey just in general. In 2016, they came to us and they said they wanted to start virtual care. And at the time, virtual care had of course been around for a little bit, but it wasn't something that we knew a whole lot about. So we had our very first nurse-assisted virtual clinic that we started. We started it at a factory in Dalton, Georgia. It was nurse-assisted, so we have an occupational nurse that works out in the plant location there. And so we launched our very first virtual clinic. It looks like a really large iPad that had touchscreen, and then it had peripherals on it, so the nurse could help with the provider on the other end of the line so that they could see and hear things to conduct a good visit. By 2017, we recognized the need that we needed a dedicated virtual provider on the other end of the line. So what we were originally doing is connecting to whatever providers were able to connect virtually. But Mohawk let us make the investment in 2017 to hire a dedicated virtual provider. By 2018, we had 8 different virtual locations that were very similar, same care delivery method as the 2016, and 2 dedicated providers at that point. We were also able to work with some network specialists or some network people out in the Northwest Georgia area that were behavioral specialists, and they were willing to connect with us as well and our patients through the virtual kiosk. In 2020, we were able, because of COVID, we were able to kind of accelerate some things, and we were able to not only provide the virtual care through our kiosk and our on-site virtual clinics, but also through iPads and smartphones. And then by 2022, all of our Mohawk and Evernorth, the dedicated employees had the ability to connect with our employees nationwide through these methods. So we had all of our coaches loaded on the platform, as well as all of our providers, and they were able to see any patient in any of the states that they were actually licensed in. Down at the bottom of the screen, we did a quick timeline just to show, so virtual care was a little slow to start. And so we started in 2019 where we saw about 720 visits per year. These are just the virtual visits. I'll point out that I think that we had a really nice method to make sure that we were connecting with the patients, not only virtually, but also touching them like in person. So our virtual provider made a commitment when she first started seeing these patients that she wanted to see them in person. So Sally Joe may have an ear infection today and she connects with our provider, Misty, through her virtual connection. But Misty may say, hey, Sally, I'm gonna be in Muskogee, Oklahoma in 3 weeks. And I see too that you have diabetes. While I'm there, can we go ahead and make an appointment for you there? So then Misty became a real person to them, and it kind of solidified the relationship that she had with those members, that they were not only seeing for acute care needs, but that they were also able to connect with Misty face-to-face for their chronic condition management needs. I'll point out too that we do charge a $20 copay for any acute care needs, but for preventative or any kind of chronic condition management, it's free to the Mohawk members. So then you just see our progression of visits and how it really accelerated by 2021 and how COVID kind of pushed us to think a little bit differently. And we saw almost 8,000 visits through our virtual kiosks, through our platform, through smartphones, iPads, and even some telephonic visits through the COVID period. And then even though that, I'd like to say COVID's calmed down a little bit, we're thinking differently about the way that we deliver care now. And so for 2022, through the end of June, we're already at over 6,000 visits, and the team's made a commitment to try to make it to 9 by the end of this year. So, John?
Okay, awesome. Thank you, Shannon. So we're gonna go from one end of the spectrum, to a client with 21 wellness centers and 84 FTEs, to the other end of the spectrum, and focus on a client that has one wellness center with 1 FTE. So this is the city of Miami, Florida. And let me really explain how this particular model works. So again, it's a registered nurse. The registered nurse, it's in a little trailer. One of their main issues that they had with having a wellness center was they just literally had no space. So with this particular model, it's extremely modular. You don't need the big capital, all the space of a traditional brick and mortar wellness center. This literally is in a trailer. It's wrapped, it's beautiful. But it works like this. There's a registered nurse that's doing chronic condition management, lifestyle management, all the traditional nurse coaching functions. But when somebody presents with an acute care visit, let's say a sore throat, ear infection, we can connect using the Tyto devices. What we're passing around now is Tyto Home. We'll get to that story here in just a moment. What you see here is called Tyto Clinic. This is where the nurse can connect virtually to an off-site provider. There's a lot of flexibility with the off-site provider. So for the city of Miami, they decided that they wanted the off-site provider to be one of the local health systems. We can also support with that as well. So again, certainly a lot of flexibility. What we are seeing is, especially from a sales standpoint, are there going to be times for your 5,000 square foot brick and mortar? Yes, but we're starting to see a lot more of these nimble type wellness centers present. This could be a hub and spoke. We're doing this for a client in the Mid-Atlantic, where they have one brick and mortar wellness center, and then they have the spokes of these other virtual. So the registered nurse is dialing into, through the Tyto devices, the nurse practitioner. So with this model, there's a lot of flexibility. What we call this an assisted model, meaning there is a registered nurse assisting, giving that white glove treatment, really sitting down side by side with the city of Miami associates, because some of them may not be comfortable with technology, and sitting right next to them while we pull up the virtual provider. And we'll share with you here in just a moment. We actually shot a video about 2 months ago at the city of Miami, so you can kind of see it come to life. But we're also have an unassisted model where you could have the TITO devices. There's a school district in the Mid-Atlantic that has to have, I think in the 3rd year, we're going to have 100 of these, one at each school that will be funneled into the brick and mortar facility. So again, it's just taking telehealth to another level using these diagnostic tools. So let's share the video, and hopefully this will give you a further representation of what it looks like.
At Evernorth, our approach to healthcare gives you and your employees access to customized, convenient, cost-efficient care right at the worksite. An Evernorth Health and Wellness Suite is powered by the expertise of a registered nurse and virtual connection to a remote provider. Evernorth Health and Wellness Suites offer primary, acute, and preventative care, along with health and wellness programs and health coaching. Here's how it works. Let's say you have a sore throat. Your Evernorth Health and Wellness Suite makes it easy to access high-quality health services without leaving the worksite. To schedule an appointment, simply use MyChart Online or the mobile app. When you come in, the nurse will go over your medical history and discuss the reason for your visit. They'll also check your vitals and begin any necessary lab tests. The nurse also notices your blood pressure is slightly elevated. This is something they'll discuss with you and will be sure to mention to the provider. Next, they'll get you connected to the virtual provider. The nurse will manage the exam, taking direction just as if the provider were in the room with you, and they'll communicate important information to your provider, like your high blood pressure reading. The provider makes a diagnosis of strep throat and shares a treatment plan, including a prescription that's sent to your local pharmacy. They also discuss lifestyle changes and possible medication to treat your high blood pressure. With an Evernorth Health and Wellness Suite, it's easy for your employees to access personalized healthcare right at the worksite. So let's talk about putting this powerful solution to work for your organization, and we'll create a healthier, more productive workforce together.
So it's certainly a different model, right, from what we're used to. So what we've seen from a results standpoint with this model, first it all starts with the member experience. How's that going to be impacted? We have not seen any drop in our NPS scores from our traditional brick and mortar to our health and wellness suite. So we're still averaging 95.5 NPS with this particular model. So it starts there with the member experience. Results are good. Quality, right? So we can do about 80 to 85% of the services of a brick and mortar wellness center with this particular model as well. So the quality certainly is there. And then when you think about costs, right? It's much easier to achieve an ROI. This is typically about 25% the cost of a traditional brick and mortar wellness center. Again, so you don't have the expensive capital outlay, the operating expenses going forward as well, significantly less. So it's quicker to achieve that return on investment. So we will transition now into our third and final use case. We have actually done this for 2 clients so far, Palm Beach Sheriff's Office and Cigna is a client as well. So Shannon, I will turn it back over to you.
Yeah, great. Thank you. So we definitely wanted to showcase some of our partnerships with TITO here. And so we did partner with Cigna a couple months ago. And actually we were able to get 200 TITO devices to distribute to Cigna. So the way we did it was we actually sent out an email blast, and we asked people if they wanted to participate in a pilot for at-home virtual care, and that we would give them free technology to do it. We didn't know how fast people would respond, but fun fact, people love free stuff and they like free technology even better. So we actually distributed 200 devices in about 45 minutes. We were shocked. But the only thing about stuff like this is you don't need it until you need it. So we've been doing the pilot for a couple of months. We've had 82 visits. Like John said, for just overall satisfaction scores and NPS surveys, people love it. So if your kid's at home and they're sick, they have an ear infection and you don't want to go anywhere, the telemedicine visits through your telemed vendors are mostly just FaceTiming. This really gives the provider on the other end of the line the ability to have a quality visit. So you're able, and we're passing it around, but it is able to provide a pretty nice visit where you can see in the ears, it has the otoscope, you can see down the throat. It has a stethoscope attached to it, and it's really pretty easy to use. And so if you have problems, your children can probably help you figure it out. We did put just a couple of things on here, just what we're hearing our patients say, but also our providers. And so one of the things one of our patients said is that they've already used it 6 different times for ear infections, once for COVID. They said it was great, and that it really provided them a way to have care from the convenience of their home. Our clinicians on the other end of the line, for those of you that are clinicians, will appreciate that it's given them the ability to have a clear visit of, whatever's going on with the member. They can actually see and hear things. And in some cases, it's even more clear than being face-to-face, because you can capture the images, you can listen to them again. They're linked through our Epic, through our MyChart app. So they move into the patient's chart. And so they can go back and look at them or listen to them, whatever they need to do. Our pilot with Palm Beach was a little bit different. We have a large clinic footprint in Palm Beach for their sheriff's office there. And so what we did there is we gave 30 devices to our clinicians on site. We told them that they could give it to whoever they wanted to. So the use case for them really has been, if a patient's newly diagnosed with a chronic condition, could they give it to somebody that maybe just got diagnosed with high blood pressure or just got diagnosed with like a diabetes, and they say, I want to see you again in a couple weeks just to see how your new medicine's going, but you don't have to come in. I'm going to give you this device, and I just want you to connect to me from wherever you are. We'll do a quick visit and we'll move on with our day. So that's been really nice. They've also used it for a couple of spouses that are kind of immunocompromised. They don't need to be in a clinic setting, especially with COVID or flu season kind of on the horizon. So that's been nice, as well as maybe people that have kids that just have a lot of illness, especially with school starting back up, and maybe they're frequent flyers to the ER or just some urgent cares. So that pilot's only been going on for three weeks or so, and they've had, a couple handfuls of visits, and so far it's going really well, and the patients again really love it. And again, for the practitioners in the room, I think that you'd appreciate one of our nurse practitioners, Angela Turner, had said, this Tyto device as a provider gives me confidence in treating the patient, because she can actually see and hear what's going on with them. So, just a couple pilots that we wanted to share with our partnership with Tyto and the cool technology that people really appreciate, and that's actually pretty easy to use. So with that, we'll move into one last video.
Tyto medical exam devices help make virtual visits with remote providers simple and convenient. Here's how they work. Let's say you have an earache and make an appointment through MyChart for a virtual visit. MyChart is a secure portal that allows you to schedule appointments, communicate with your provider, review prescriptions, and more. You'll start your visit by logging into the MyChart app on your computer, smartphone, or tablet. Next, turn on your Tyto device. You'll need a Wi-Fi connection and a quiet space for your appointment. Make sure the app and the device are connected, and the provider will start the visit. Your provider will connect to the Tyto device and guide you through the examination process, specifying any adapters needed for your virtual exam. Because you're seeking treatment for a suspected ear infection, you would use the included otoscope adapter for the virtual ear exam. Once the exam is complete, the provider will develop a treatment plan, including prescriptions if appropriate. With Tyto devices, it's easy to access high-quality, personalized healthcare services, all without ever leaving the home or the worksite.
All right. Well, thank you, folks. That concludes the presentation part. And just want to see if there's any questions. Yeah.
So first question is, what does it cost and what's the reimbursement structure look like for a virtual provider visits with a local health system versus an internal provider?
Well, with our internal providers, it's just whatever the solution that they have according to their own health plan. So as many of you heard yesterday, a lot of our clients just charge whatever they think the fair market value is. So usually those copays range anywhere between $20 and $35 a visit. Some of them just do it for acute visits. Others don't charge anything at all. And then otherwise, if you went out into the virtual market, you would pay like with an Indie Live, if you used your insurance, it's just your copay again, or if you had just a virtual visit, it's about $55. Like John said, these are pretty inexpensive models. They're perfect for locations that don't have a large employee base, or if you want to send things home with individuals, maybe you have a sales team that sit out, in another territory or something where there's only 10 of them and they're complaining because they don't have the same benefits as everybody else that's on site. These are kind of perfect for them. So pretty inexpensive. It's the same exact copay as what you would see if you went into one of our on-site clinics versus the market.
So does the center would buy a supply of the Ty2 and then give them to someone and then it comes back? They bring it back, or you just distribute it to the patients?
Well, you could do it a couple different ways. So with the pilots, what we've had is we've bought, a couple hundred different devices for the clinicians to distribute or for the client to distribute, however they decide they want to do that. Or with the City of Miami location, that's just a Tyto device that's just kind of a virtual wellness center. And we just partner with Tyto to use that as our peripheral so that the provider can see and hear the visit on the other end of the line.
So what do the devices individually cost, or the kiosk approach?
Yep, so my friend from Tyto, I'll phone a friend in the back.
There you go. Phone a friend.
Okay.
Hold on a second. Is there a microphone?
Yeah.
Let me turn that on.
Testing 1 2 1 2.
Thank you so much. So to our Evernorth partners, thank you so much for the really awesome presentation and the kind words that you spoke about in terms of Tyto. By the way, my name is Chris Urban, and I feel that since I'm here in Nashville, I have to say that I am not related to Keith Urban, so I just wanted to get that out of the way. But with respect to the cost of the Tyto devices, so Tyto Clinic, which was mentioned, which would be the on-site device, that is approximately about $2,300 per device, and that's an annual cost. And then as far as the Tyto Home is concerned, it's about $200 annually as far as that device cost is concerned. And so the big distinction between Tyto Clinic and Tyto Home is that with the Tyto Home, you're obviously going to be able to use that anywhere you are. So no matter if you're home or on the road somewhere, and it's not only you, but it's also your dependents that would be able to go ahead and take advantage of that as well. So essentially, that's the main difference as far as just the ability to use Tyto Home versus Tyto Clinic, where you'd be on site. Does that answer the question?
Yes, thank you. Thank you.
A pulse oximeter? So it does, yes. Yep.
And in the back.
So another question. With all the staffing shortages, how are you staffing and maintaining all the clinics?
Staffing is a challenge. We're working with our recruiting partners to make sure that we can staff clinics accordingly. But this really helps. So you can have, I'll use my Mohawk provider as an example. So she services 8 different locations. And we just build a schedule for her that she can have those different schedules built where she can service multiple locations in one day. That really helps with staffing. And then, for Tyto, you don't necessarily need an RN or an LPN. You can have a medical assistant to help service the device. In the self-assisted, which we're also looking at piloting, just having a self-assisted model, you would probably just need like an admin assistant or something like that, just to make sure that the device is staying clean, that parts don't walk away. So it helps us to be more efficient and think a little bit differently in how we staff.
Okay. Are there any head-to-head comparisons between the virtual in-person population cohorts that look at various outcomes like H1C, blood pressure, et cetera?
I don't think so. I mean, we still look at the same quality measures. The devices are pretty accurate. I don't know. Does that answer?
Yeah. Well, I mean, when you compare 2 people who use one in person and one using the virtual for the same condition, do they tend to come out the same, or quality issues? Or
yes, I think so. And just to reiterate what the providers are saying, like I think that sometimes it's an even better experience for a clinician on the other end of the line because they can go back and look at those images again. For an example, if you look in somebody's ear and you're like, oh yeah, you definitely have an ear infection. But they can go back and actually capture those images, look at them again and again. They could even like follow back up. You had a really bad ear infection. Let's look at it again this week and see if it's improving and kind of keep pictures in the chart to kind of scale it down. Same for blood pressure. So you may hear different things just through your stethoscope. It's recorded now in the chart. So maybe you think you hear something when you're listening to somebody in person and you go back and you're like, no, maybe I didn't hear it. With this, you can go back and listen to it again. So in some ways it's an even better visit.
Great. Let's thank Shannon and.
Larry, I think we have one question in back.
Question over
I'm
there. I'm sorry, go ahead.
Yeah.
One more.
So this probably is for Ken. So Keith? Oh, okay. So if I have 20 employees in a very remote area, so it would just cost me $2,300 for the device. And then it would be $200 annually for the thing that I just saw, the Title Care. So I could basically have an admin person there dialing into a practitioner and we could take care of all of them.
Although I do want to go ahead and preface that there are minimums, right? There needs to be scalability as far as, from a Tyto perspective. So for the Tyto clinic, there would be a minimum of 30 clinics that would need to be purchased as far as being utilized, being deployed for your organization. And as far as the actual Tyto home is concerned, the minimum threshold there is 500.
One more, and then we have to go.
Shannon and John, can you guys talk about what the nurse does when they're not facilitating visits virtually?
Yeah, sure. So the nurses that we have today in our virtual wellness suites are also certified wellness coaches. And so we're really thinking about if you don't have virtual utilization for the actual visit or care delivery, what else could a nurse be doing? So we've just made sure that we have RN health coaches that are helping to service the model. So it's kind of like you kind of get the bang for your buck. You have a health coach that can really dive into the health plan data, do outreach for different chronic condition management things, and then funnel them back into the virtual provider as needed.
Great. Let's thank John and Shannon for a nice presentation.